Well, good day, everybody. This is Chris Baer. I'm the paramedic coordinator for the EMS program here at Doñana Community College. And I want to make this video to act as a high level or a high yield orientation to the paramedic program here at Doñana Community College, specifically focusing on the incoming Las Cruces Fire Department accelerated paramedic students. I feel that this will be helpful because of the unique nature of the curriculum that you're going to be experiencing. It's fundamentally the same curriculum, but the way that we're going to be covering the curriculum is a bit different than our traditional paramedic cohorts. And so I want to take the opportunity to do an orientation to the program, the courses, and the online learning management systems that you're going to be interfacing with throughout the next 9 months or so, starting in February, and then hopefully ending by the end of the year around December or so. So that is what we have tentatively planned for you all. So first, I'd like to welcome you. And I'd like to welcome you as you embark on this journey. This will certainly be probably one of the more challenging experiences of your life, at least from an academic standpoint, simply because the content of the curriculum is going to be rather condensed. So I want to do a high yield overview of the general curricular pipeline at our program. And when it comes to the paramedic curriculum, we start off with the so-called prerequisite courses. This is foundational. These are foundational courses that provide you with some basic paramedic foundation that then we add on to in specific courses that focus on specific aspects of paramedic practice. So when you begin, the first several weeks of your student experience will be the 3 prerequisite courses: the Introduction to Advanced Care, which focuses primarily on the medical, legal, and operational aspects of EMS. This should be fairly familiar content to you all, and it's going to focus on documentation and charting, communications, radio systems, the basic operational environment of EMS, safety, health and wellness, medical terminology, patient assessment, advanced patient assessment and clinical decision making, as well as talking a little bit about evidence-based medicine, in addition to some other topics. And then that will transition into the second prerequisite course, pathophysiology. And pathophysiology will build upon the foundation that you all should have in anatomy and physiology that you developed at the other levels of EMS. Primarily, we anticipate the vast majority of you will be licensed at the intermediate level here in the state of New Mexico, or the AEMT, for those of you that carry national certification. And so we will build upon that foundation and focus on talking about the nuances of disease processes and some of the major things that happen in states of disease and their physiological implications when it comes to the patient and how the patient presents and how we can think about developing treatment plans for patients. In this course, we will focus on a review of anatomy and physiology. We'll focus on chemistry and the chemistry of life and the broad categories of chemistry to include general chemistry, organic chemistry, and even a little bit of biochemistry and some smidge of inorganic chemistry as well. And then we will develop, from there, we'll develop a basic pathophysiological understanding of disease broadly, risk factors, basic disease pathways, or basic pathways that are very similar between a variety of disease processes: ischemia, necrosis, apoptosis, and some of these high-level things that happen in general disease states. We will also talk about the basics of human growth and development. And then that will transition into the third and final prerequisite course, which is actually divided into two separate courses, and that is pharmacology. There will be the pharmacology lecture and the pharmacology lab. And in this course, we will take a deep dive into the principles of pharmacology, some of the medical, legal, and historical context of pharmacology. We will talk a little bit about categorization of medications and concepts that are important to appreciating pharmacology and developing drug profiles, to include a study of an overview, at least, of pharmacokinetics and pharmacodynamics. That will also include pretty detailed discussions and labs around medication administration, dosage calculations, and accessing vascular access primarily for administering parenteral medications, so intravenous access, intraosseous access, intramuscular, subcutaneous, intradermal, and sublingual, and some of the other enteral and parenteral routes of administering medications. A big part of this course will also include having you all having to perform a drug profile or produce a drug profile on every medication that is within every medication or category of medications that exists within our scope of practice in the state of New Mexico. Once we complete those three prerequisite courses, then you will move on into the primary academic pipeline for the paramedic program. And that pipeline will start off with ECG interpretation. That will transition into cardiovascular emergencies. As a part of that, you will all have to successfully complete advanced cardiovascular life support. And then that will give way into airway management and pulmonology. We'll have two blocks of instruction that cover medical emergencies, Medical 1, Medical 2. We will have a special populations block that will cover obstetrical emergencies, pediatric, neonatal emergencies, and other special populations. And then finally, you'll have a trauma lab and lecture that will focus on trauma management in the paramedic context. Once you complete the academic pipeline, we anticipate the primary academic or didactic courses, which are primarily lecture and lab-based. We anticipate that you will complete those by the end of May. And then in the summer, we front load all the academic content. And then in the summer, we anticipate you entering the clinical and field environment, where for about 10 to 12 weeks, you will be spending at least 2 days a week, 12 to up to 15 or 16-hour shifts in some cases, depending on how busy you get and what kinds of specialty experiences you're involved with. But you will be spending at least 2 days a week in the hospital doing clinical rotations. And then you will also, in addition to that, be spending multiple shifts on an ambulance or a squad with a paramedic preceptor that is primarily responsible for 911 calls and the full spectrum of EMS care, from point of patient contact through patient transport and transfer of care in a definitive setting. That will also include interfacility transfers and transports, depending on the specific service where you find yourself riding. And you can expect several hundred hours of clinical, hospital, and field ambulance rotations through the summer. And if all goes well, we anticipate you entering the final phase of the paramedic pipeline, if you will, or curriculum in the fall, so starting around August to September, which will include an internship, or this is sometimes referred to as your capstone experience, where you will be synthesizing all of the prior experience and you will be expected to take on the role of a paramedic team leader under the supervision of an approved paramedic preceptor. You will work that preceptor shifts, and you will be expected to take on the role of the team leader for the calls during that rotation. You will complete that rotation, and then there will also be something called a prep for practice or preparation for practice course that you will be completing at the same time, which will focus on final skills in scenarios, verification and completion, as well as a variety of testing situations that aim to prepare you to encounter and negotiate the National Registry Emergency Medical Technicians Paramedic Board Exam. And then at the end of your internship and prep for practice experience, there will be a final, what we call psychomotor or skills testing process, where you will encounter a variety of simulated patient encounters where you will have to demonstrate mastery of specific skill sets to include medical patients, trauma patients, pharmacological knowledge, cardiovascular knowledge, etc. And then we anticipate by the end of next semester, so by the end of December, if all goes well for you, you will be completing the program and moving on to negotiate national registry testing, get your certification, and ultimately license as a paramedic in the state of New Mexico. So then you can go into your field internship process at Las Cruces Fire Department and make the transition to a fully qualified paramedic. So that is at the highest level what you can expect. To get a bit more granular, what's going to happen is because this is an accelerated curriculum and because you will be expected to act as a paramedic student, and that role is going to be your primary job for the next 9 months or so. You will actually be a student from Monday through Friday, so that's 5 days a week, starting at about 8 in the morning, going till 1700, maybe even a little later, plus or minus, depending on how things go. Monday through Friday, during the first several months, from the beginning of February to around the end of May, right? You will be in the class essentially 0800 to 1700 Monday through Friday. Some of that will be at Las Cruces Fire Department, where you'll be doing lectures typically in the mornings. You might have a short lunch break, and then you will have lab activities in the afternoons. And you will be doing that Monday through Friday, and you will not be following the New Mexico State University / Doñana Community College student schedule. So you will not be taking holidays when the rest of the college would normally take holidays. And again, so there won't be, spring break, for example, those sorts of things. You will continue in your courses. And again, that is to ensure that you can get through that academic pipeline by May. So you will be working that 5 days a week, 0800 to 1700 throughout the from starting in May, starting at the beginning of February to around the end of May, and you will be following that schedule. I am primarily going to be responsible for generally how your courses are set up and how they're delivered. Although I am in the middle of another paramedic cohort, and I have to ensure that I'm responsible for those students as well. And so what's going to happen is what we anticipate is typically every Monday I will be at Las Cruces Fire Department if courses are happening there, or here at Doñana Community College, depending on where you're at in the pipeline and what kinds of resources you will need. You will either be at LCFD or over here at the East Mesa campus in our labs. But at least one day a week, every Monday, I will be present to kind of get the week set, be able to answer any questions, deal with any issues that couldn't be dealt with in the preceding week. And then I will be handing the rest of the educational delivery over to Eric Palma. So Eric Palma is going to be your primary point of contact at Las Cruces Fire Department, and he is going to be for lack of better terms, he is going to be your primary instructor. So outside of Mondays, Eric will be facilitating, and he will be helped by a variety of other individuals. Some of them are employees of Las Cruces Fire Department. Others are from outside of the Las Cruces Fire Department. Some of you know Ann Bellows, who was our former program director here, EMS program director. She retired last year. She's coming on board to help. I believe Francis, who works at LCFD, will be helping as well as other individuals will be popping in and out. But the lion's share of the work will be spearheaded by Eric Palma, and then I am going to be present at least a day a week in kind of running things in the background. And that'll essentially occur throughout the entire program. When you start field and clinical rotations, we anticipate our newly hired, at least full-time, but she's been an adjunct faculty for quite some time, but Petty Ersted, many of you know her because you had her as a clinical coordinator when you went through either EMT or AEMT courses here at the college. She has recently come on full-time faculty as a clinical coordinator. And so she will primarily be responsible for scheduling and coordinating your clinical and field rotations starting in the summer. Although I anticipate that I will be present in the hospital several days a week to facilitate student experiences, even though Petty will be your primary point of contact and will be the instructor of record on your courses. You will be interfacing with me. We anticipate you'll be interfacing with me. I will physically be present in the hospital, engaged in patient care with you all, and facilitating those experiences in addition to other individuals. So that's kind of what we're going to see on a bit more of a granular level. So what's going to happen is this is going to be a very fast-paced, and we are looking at about a week and a half per block of instruction. All right, so you're looking at about 7 days or so, right, Monday through Friday, 7 days. So Monday through Friday, and then on into, like say Monday, Tuesday, Wednesday, and then moving on to another block of instruction. So you're going to anticipate about every week and a half, you're going to be taking a block exam. You're going to have large homework assignments due. Every academic block of instruction will be accompanied by chapter summaries that you will have to complete. And that will be a large homework assignment for every academic block, starting at intro, going all the way through special populations. In addition to that, you're going to have quizzes, you're going to have lab activities. There's going to be a research this tends to occur during cardiovascular emergencies, where you will research a topic and then present it to the rest of the course, typically in small groups, and you'll have to write a paper using APA format and using in-text citations as well as developing a references page. So you're going to have all of this other stuff occurring as well. So you're going to be very busy, and I want to just take you through how things are generally going to look. And so to do that, I'm going to share my screen with you all. All right. So what I've done here is you can see this link here that says https://dacc.nmsu.edu. This is the homepage for Doña Community College. Now, Doña Community College is technically considered an academic diversion, an academic division of New Mexico State University. So we are ultimately a part of the greater NMSU ecosystem. So you're going to see that bear out in some of the links and whatnot. So if you go to the homepage, here on the upper right, you're going to see this link that says My NMSU. When you click on that, you will have to put in your authentication requirements. And there have been, in recent years, new security measures that have been enacted at NMSU, which DACC is a part of. And so there are some additional steps that you're going to have to go through to get logged in. So you're going to have to put in your username and your password, but then there will be additional authentications. What I would recommend is to use an authenticator and set your phone up as a authentication device, or what we call a pass key. And then you will use your phone to authenticate things through your authenticator app. Microsoft has a free authenticator application that you can download and use. And then every time you log in, it will ask you to authenticate. You go to your authenticator app, and it's already preset, and you have your passkey set. QR code will flash on the screen. You scan that with your phone, you accept, you use your whatever biometric identification protocol your phone uses, Face ID, fingerprint sensor, what have you, and then that will authenticate things. So it's an extra layer of security. As you know, cybersecurity is becoming more and more critical, and some of you may be aware of what happened last year at Western New Mexico over in Silver City, where their security was breached and taken over, and they essentially lost everything. And it was an absolute kind of disaster for them. And so these extra layers of security attempt to make your information that much more secure. So you're going to click on that link. You're going to get logged in, and it's going to bring you to your home page as a student. When you get logged in, that looks like this. This is a completely redesigned homepage. It's less than a year old. And essentially what they've done is they've gone to what are called cards. So these little boxes are called cards, and each box has a specific aspect of the student experience that it focuses on. And you can actually take these cards and see, if I take my cursor and I move over, you can grab them and move them around and arrange them how you want on your homepage in My NMSU. All right. So probably what's going to happen is you all are going to want to take the canvas here and move your canvas up to the top like I just did here. Take your email, your Outlook email, My NMSU email, and move that up because these are going to be what you are primarily going to be interfacing with more often than not. All right, Canvas and email, so you can see how I dragged them up there. All right, you click on your email, and then that will bring you into your Outlook email here. All right. And then Canvas is the primary, what we call LMS, or learning management system. This is where you're going to actually access the content of your courses, the notes, the quizzes, the assignments, the syllabus, etc. So when you click on Canvas, you click on Login, and generally it will log itself in once you have already gone through the basic login authentication, a login process for NMSU. You click there, and it's going to bring you to a page that looks like this. This is your Canvas dashboard. And then what you're going to do is you're going to click over here on courses, and it's going to bring a list of courses down. It's going to look a little different for you. As a faculty, I have uh, courses that I'm actually the one who's making your courses in Canvas, and so I have, these are courses that I'm still developing, and then these are courses that I've already published. You're just going to have a list of classes that you're registered for each semester. And you can see that I actually have your first course, the intro or introduction to paramedic practice, and you all are going to fall under section 99. Because we have two different paramedic cohorts. The traditional paramedic cohort is section D01, and you all are going to be 99. That's helpful mainly for me to differentiate you all from the other course, from the other cohort. All right, so what you're going to do is let's say that we're going to start off with Introduction to Paramedic Practice. That's OEEM. OEEM is just a number that the college uses to designate a specific type of course. So all OEEM courses are a part of the EMS program. All right, that's all that means. So OEEM 2, 2 is the level of course. And so with your typical undergraduate degree, if you're working on an associate or a bachelor's degree, there are 4 levels, right, for each year, right? Your traditional 4-year bachelor's degree. So your 100 courses are like your entry, your first year, what would you take as a freshman student, and then level 2 courses are the second year. And because the paramedic program is embedded within an associate degree, any paramedic level course is going to be considered a 200 level course versus other courses like the EMT basic course, which is OEM 120. That's a more intro level course, or the EMT intermediate / advanced EMT course, which is an OEM 150. Those are the 100 level. And then as a paramedic, you are at a higher level, if you will. And so all of your courses will be 200 level courses. So what you'll do is you will click on that course, and that will bring you into the course. And all of your courses are going to be more or less set up the same way, where you're going to have this introductory page here, where it's going to have the name of the course. There will be a photograph of some sort, again, just to kind of something that's somewhat relevant to the class. So this is just a picture of me when I was in Afghanistan, and just talking about complex operational environments because that's relevant to the operations that we will cover in the OEM 206 course. You're going to have links. You're going to have a Start Here link. You're going to have a syllabus. You're going to have a modules, and you're going to have a student resources link. All right. You're going to have the instructors. So primarily myself and Eric Palma. Contact information, the basic course dates. So we'll start 9 February to 18 February. So we're doing an entire block of instruction starting February 9th and ending less than 2 weeks later on 18 February. All of the content in that course, a week and a half essentially, and then just a basic rundown of the course. So what you're going to want to do is, if this is your first time, you're all going to want to do this because this is the first time you've been a paramedic student, is click on the Start Here, and that will bring you through a basic introduction. There is a link to training for Canvas. This is about a 30-minute, about a half an hour long training course that orients you and familiarizes you more comprehensively to the Canvas environment. If you're okay with, if you need that, just click on that and that'll bring you the video. If not, you can just click on next. And then this just talks a little bit about getting started in introductions. All right. And there are different steps. Go through these steps, go through the information, introduce yourself in the course introduction, which is down here in the student introduction activity. I also have an introduction to myself, just a basic biography / bibliography. You can click on next and then get started. Click on that. And then that will bring you into what's called the modules view. Now, you don't have to go through that every single time you log in. Once you're familiarized with Canvas, all you have to do is when you get to your home page, you can just click on modules, and that'll bring you this modules link here. That'll bring you directly into modules. You can also find a modules link over here on these links in the far left side of the web page. So if I click on that, that will also bring you into your modules. And so essentially what I've done with every one of your courses is you have your introduction module, and then you have the academic content modules. So you can see in this particular course, we're going to start with chapter 1, which is EMS systems. I will include a chapter outline, which is basically like a TLDR, Reader's Digest, down and dirty overview of the chapter. So these are notes that you can download or even copy or print. The PowerPoint, the presentation, and then any additional information, for example, a community paramedicine link, which is some additional content that's not specifically in the textbook, but is still content we want to cover. And then safety and wellness, injury prevention, health promotion, documentation. And you can see that I have a bunch of additional content in here. So you all will be learning D-chart and SOAP notes and using D-chart notes to write your field patient care PCRs, patient care records, and then you'll be writing SOAP notes in the hospital during your clinical rotations, and we'll talk about those: unapproved abbreviations, communications, medical legal, ethics, research. All right. So all of the part 1 preparatory chapters in the textbook are covered here, and then we'll also be going through patient assessment. So communication, history, scene size up and primary assessment, secondary assessment, clinical decision making, and then there will be some additional advanced assessment skills like using an otoscope, using an ophthalmoscope, doing a more complex neurological exam, cranial nerve exam, vertigo assessment, lung and heart tones will also be a part of the advanced assessment skills. And then there will be some operational specific chapters such as ground and air operations, crime scenes, awareness, etc. And then what I've done is because the traditional paramedic program is what's known as a hybrid program, where the lectures are online, so people log in when I lecture. They log in through Zoom and we lecture, and I record those lectures. And so what I've done is I've actually included last year's lectures, or actually this would be last semester's, well, technically is last year's lectures. And so you can use these as study references if you want. But I want to be very clear, you all will not be doing online lecturing. Your lectures are going to be in person. So you will be showing up in the morning before 0800, and you will be directly interfacing with an instructor for your lectures. But I wanted to include some of these past lectures that I've done so you have them available as a study reference. All right. Now, there may be quizzes and other assignments associated with these courses. And if you see here, there's a link that says quizzes. If you click on that link, the only quiz that you really are going to have here is a syllabus quiz. And so you can click on that, preferably after you go through the syllabus. And then there is a final exam. And for the most part, your final exams are actually going to be taken through a different learning management system, but I still have to put your exam grade into Canvas, and so that's what you're seeing here. All right. So that is the basic rundown of how things are going to look on Canvas. The last thing I want to mention is the syllabus. You click on the syllabus. This top link allows you to download the course syllabus, and we will go over the syllabus at the beginning of every academic block. And then this is the basic summary of the course of when certain things will be due. So you can see that there are some other assignments here. And if you click on the assignments link on the left side, this will bring you to a list of your assignments. The attendance is something that we do, so you don't have to worry about this. But you can see that there are different assignments like professional organizations and EMS systems and history taking and uploading hazmat awareness completion certificates, as well as ICS completion certificates, and so on. And you can see the due dates and times of those specific assignments. All right. So that is how you access the lion's share of content that you're going to be engaging with in Canvas. All right. So then that brings us to the other LMS or learning management system, and that is called Platinum Planner. We will do a more comprehensive overview of Platinum Planner because I'll have to get you all registered and get you all an account in Platinum Planner, but I just want to at least show you what this is. So when you log into Platinum Planner, it has two major components. It has something called EMS testing, and EMS testing is where you will take the lion's share of your block exams or your final course exams. There are a couple of courses where the exam is through Canvas because there are so many diagrams and pictures and things like that that it works better in Canvas than on EMS testing. So for example, your ECG interpretation final exam is on Canvas, but by and large, the majority of your block exams, you will log into Platinum Planner, you will log into EMS testing to take those final exams. And don't worry, we will show you how to do that later on. I'm just giving you a basic overview of how things work out. So that's EMS testing. The other component of Platinum Planner is Platinum Planner, and that is where you are going to track all of the skills, scenarios, and patient encounters. All of that is going to be tracked, and so you will document. So anything that you do in a lab, skills, simulated patient encounters, and anything that you do in the hospital clinically or on the ambulances or squads in the field environment, those patient care records and the skills that you perform need to be documented, and that will be done through Platinum Planner. So if you go into Platinum Planner, it looks a little different for me than it will for you, but it's a very similar interface. You just click and it'll just say LCFD Spring 2026 Accelerated Paramedic. That's the cohort name that you all are going to be placed in. So that's the only option you'll have. So when you go in here, what you're going to have up at the top here is you're going to have labs and you're going to have opportunities. If we are working on a skills lab, which we will be doing for the first few weeks of your experience as a student, working on specific skills verifications, you will click on that document, manage documentation, and then you will document. There are actually skills sheets that get filled out, and then they get sent through, and we'll talk about how you do that later on. Again, this is more of a high yield overview of things. And then anytime you are performing patient care, either simulated patient care, so there are certain simulations in simulated patient encounters, or actual patient care, either a field shift or a clinical rotation in the hospital, you will document patient care under the opportunities. And so every day, if there is a lab for that day, I will be putting those labs in Platinum Planner, and then you click on the lab and you go through the lab, and then you fill out the skills that you complete and send them through for approval if you are scheduled to be in the hospital or on an ambulance, or if we are doing patient simulations. So labs are going to be more skill focused, but if you're doing an actual patient, a simulated patient encounter where you're using multiple skills, you're doing assessments, you're making decisions, reassessments, that needs to be documented as an opportunity. And you do have the ability to add skills into the opportunities as well. Again, we'll talk about how to do that as we get further along in the course or in the pipeline. This is just a basic overview. All right. So that, I believe, is where I'm going to conclude things for you all today. This is just more of a high yield basic overview of some of the major expectations, what things are going to look like, again, for the next 9 or so months, and the online learning management systems that you all are going to be interfacing with as you make your way through the paramedic pipeline. All right, everyone, I hope you found this video helpful, and I anticipate seeing you all here in a couple of weeks. Take care, and we'll see you all soon. Thanks so much.